Today, in the series of COVID-19, which is brought to you by News Karnataka, V4 News, Global TV, Malnadu TV, Organ Donation India Foundation, and Gyan, our endeavor is to inform and give the information about the impact of COVID-19 on different sectors. And today, we have a very important topic, and that is the impact, COVID-19 impact on police warriors' health. As you all know, the coronavirus is everywhere, and it is affecting everyone for last more than 100 days. We all are under lockdown. And the one force, apart from the medical fraternity, is who are in the front, that is the police force. They are there to control all of us so that we cannot come out, and to help the medical fraternity also. And today we have to look about their health, how they are facing mentally as well as physically. In India, the total number of police personnel is estimated to be about 2 million, that is 20 lakhs, for a population of about 1.4 billion. At an all India level, the latest tracking survey by Sea Voters revealed the biggest positive jump in image has been registered for the Indian police. While in 2018, only about 29.9% of respondents expressed a lot of trust in the police force, but during the COVID-19 in 2020, this figure has shot up to an overwhelming 70%. Indians expressing the same feeling, and they feel that they have full trust in the police force. The resources available for the Indian police agencies are very low. Despite these handicaps, they have risen to the challenges of enforcing the lockdown and promoting public health. In Maharashtra, about 4,938 police personnel have tested positive for coronavirus so far, and 60 of them have come up to 30th of June. Now, this is only Maharashtra, but if we will see the all India picture, it is far more. Now, we have to see, after all, why the police people are suffering because of us, because of the society. If we will follow the rules, then if we will not go out unnecessarily, the police warriors will not have any problems, and they will not be positive about the COVID virus. So today, to discuss about the impact on police warriors' health, we have a very, very high-powered panel with us, and this is across the India. And I would like to introduce our first panelist, first guest. He is Dr. C. Shailendra Babu, IPS. Dr. Babu is the Director General of Police, Railways, and Director, Fire and Rescue Services, Tamil Nadu. Dr. Babu is an MSc, BGL, MBA, PG Diploma in Cybercrime Investigation, and PhD from University of Madras, Chennai. He won R.D. Singh Cup for swimming. He represented India in Asian Masters Athletic Championships in Bangkok, December 2004. He won gold medal state shooting competition in 2000, 2007, 2011, 2013, and 2015. He won Champions of Champion title in shooting 2017. He cycled 4,200 kilometers from Kashmir to Kanyakumari from 7th November 2016 to 3rd December 2016. He swam 28.7 kilometers of Palk Strait from Telangana, Sri Lanka to Dhanashukodi, India in 12 hours, 20 minutes on 27th March 2018. He ran 50 marathons from 2012 to 2019. He won Prime Minister's Medal for the life savings for swimming across the lake and saving 18 people from a lake in Sivagangai during January 97. He won President's Police Medal for Meritorious Service 2005. He also won President's Police Medal for Distinguished Services 2013. He won Chief Minister's Medal for Outstanding Devotion to Duty in 2014. for curbing criminal rights. He won Chief Minister's Medal for Gallantry for Armed Encounter with Naxalites in 1993 and for apprehending elephant poachers in an armed shootout in 2000. He also won STF Police Medal for Gallantry, Bravery and Heroic Action. Welcome, Dr. Babu, on our show.
Yeah, great pleasure meeting you.
Dr. Babu, you have won so many medals and you have done so much. Apart from the police services, you have participated in the sports, swimming and shootings and whatnot and marathon, etc. Now, today the condition in India is that we are now more than 100 days under lockdown and the police force is round the clock on the roads. And many times it happens that they are working for tirelessly beyond their service hours. Definitely, it is affecting them mentally as well as physically. So we would like to know from you the COVID-19 impact on police warriors' health. Dr. Babu, please.
Yeah, so thank you, Mr. Goyal. Police, Tamil Nadu Police, as usual, is always ready for action. Has been doing an extremely good job in times of crisis. We have seen crises like tsunami or cyclone or kind of situations, but this is very special. It's universal everywhere. Problem. So from the very beginning of the lockdown, the police have really risen up to the occasion and they have willingly taken up the greatest responsibility. They had to stop the people, inquire the people, contain the people, particularly in the containment zones. So confrontation with the public is naturally an important aspect of the police work. Very close contact with the people always is there. As a result, more than 1,600 policemen tested positive. The branch I am looking after, the railways itself, there are more than 200 who tested positive. In the department I am looking after, the fire and rescue services, many of you may not even think of this department in the forefront like doctors or police officers. They are disinfecting all the streets, the markets, hospitals, making use of their own vehicles, the fire tenders, and there are also more than 180 of them tested positive. So in the police department, already 3 officers lost their lives and more than 6 IPS officers tested positive. Some are recovered, some are still in the hospital. So very nature of the job, the police being very close contact with the people, they are very vulnerable. And sometimes when they test positive, the members of the family, they also test positive, and policemen, as you have mentioned, had to work extra time. And even though there is provision to make the work much in a phased manner easier for them, 1/3 of the policemen are supposed to work at one point in time. Quarantine was given, rest was given. Still, when they come for work, they are vulnerable. Many policemen, particularly the youngsters, they stay in the dormitories, in the police quarters, where the possibility of the spread is much easier. So it's a great risk for the policemen, like the doctors. But the point is, the police have planned their work in such a way that all of them are not working at the time. So there is sufficient gap between the work, continuous quarantine is given, and all of them are tested. That's how the department has to a large extent prevented the infection among the policemen. All the policemen are periodically tested, and anybody are taking adequate precautions. The department has supplied enough number of PPE kits, disinfectants, all methods of preventive precautions have been well taken. And to a large extent, we are keeping our men more safe and secure over a period of time. In Tamil Nadu, the practice of country medicine, the Kabasuba Kudinir is believed. I can only say that much because it's debates are going on whether it's able to prevent the disease or able to produce immunity with the people. So there are Ayurvedic and the Siddha medicines that are available that is being given to all the policemen. The time-proven zinc and other vitamins are also supplied to all the policemen. The policemen are also, all places of work, they are provided with disinfectant, soap, solution, and all kinds of measures are already taken to see that policemen do not test positive, they don't contract this disease because they are, as you mentioned, they are the barriers in the forefront. They can't afford to have this disease at this point in time. So all these precautions are taken. Whenever somebody is hospitalized after testing positive, adequate care is taken. The commissioner of police is visiting them. Senior officers are visiting them. In fact, senior officers, additional commissioner of the city police himself tested positive now. One joint commissioner, a lady, has tested positive. They don't mind going and visiting them, encouraging them, because at this point in time, what is the worst enemy? As the president of USA has once said, that Roosevelt was once said that when such kind of a crisis comes up, it is not the crisis which is really a problem. What we are really scared of is the fear. We don't have to fear for anything else but the fear itself, he said. The fear is tremendous among the public. You would have read in the newspapers, a few people even commit suicide at this point in time. That much fear, fighting the fear is very, very difficult. So the police officers go there, visit them, talk to them, encourage them and give them confidence that this is not a serious issue. After all, more than 80% of the people don't even have symptoms, and 99% of the people recover. So there is nothing much to worry about it. So even in my department, I called the positive tested policemen as well as firemen over phone, encourage them to be normal, to be happy, to be confident, to deal with the situation. And once they are recovered in the police as well as in the fire department, we welcome them with a proper ceremony, with the band playing, and again supplying them with the PP, personal protection kit, equipments, kits, all other necessary equipments to them. And they come back and they work. They come back as if nothing has happened to them. By this way, we are able to maintain a kind of a confidence, some kind of hope, some kind of courage is being cultivated among all the policemen. So to a large extent, we are confident of facing this pandemic. Most of the men by that time know the protocol to be safe from coronavirus. And this is how it's being managed in the state of Tamil Nadu. So I think over a period of time, the problem of contracting this disease will come down very drastically among the policemen, even though the number of cases are increasing. And the same kind of work, the police is enforcement work, registering of cases against people who are violating the rules, norms, and keeping them under quarantine, and in some places arranging food and other materials for them. This work is still continuing, but at a much, much higher level of awareness, precautionary measures, and sense of security among the policemen. This is how things are going on now. Any other questions you have? Any particular question? I'll be very, very glad to answer your question.
Thank you very much, Dr. Babu, for giving so much detailed the preparations which the Tamil Nadu police is doing, and I'm sure everyone is doing. And you have mentioned very clearly that if anybody becomes shown positiveness, you or the senior officers, the commissioners and all other people, they visit them or they phone them, and they encourage the pupil. So, and you have also mentioned that it is not only the normal police which is doing, every department of the police, whether it's the railways, even in the fire, because they are disinfecting the roads and all those places where the disinfection is required. And you have also mentioned about the fear psychosis, and you said that how the President Roosevelt has mentioned that nothing is more dangerous than the fear.
Than the fear itself.
Yes.
Nothing is fear than the fear.
Than the fear. So, and you said that the police pupil, when they were cured and when they come back, you always get them welcomed with a proper ceremonies, with the bands playing, etc., etc. So it shows that how positiveness is there in our police force. And that's why, but the only question which is again and again, because this is not a tsunami, it's not a something which is beyond our hand. It is man-made problem which we are doing it for the police pupil. Yes, we understand that the coronavirus is not man-made, but going out on the lockdown period and giving the infections, and then the police has to come in the contact with the pupil is not acceptable in the civil society. And I'm sure that after today's program, people should take this lesson. Now I would like to go to our next panelist. He is Dr. Ravindra Kumar Singhal, IPS. Dr. Singhal is the Inspector General of Police, Aurangabad Range. He is BMA, Diploma in Information Technology, Mass Communication and Journalism, MBA, and PhD in Management Science. Dr. Singhal is in 2004, he won DGP Insignia Award. He has more than 100 commendations and appreciation letters on different occasions till today. He was awarded WI UN Medal for Service with United Nations Interim Administration Mission in Kosovo, UN MIC. He conferred with President's Police Medal for Meritorious Service on the occasion of Republic Day in year 2013. He was declared Iron Man on 26 August 2018 in France, where he completed a competition in 15 hours and 13 minutes, that which includes 3.8 kilometers swimming, 180.2 kilometers cycling, and 42.2 kilometers running.
Okay, that's Iron Man. Iron Man.
Iron Man.
It's a great sport, yeah.
Yes. And he has written books, Maligaonchi Yatra, Policing a New Dimension, and Kushwaratra Cha Kotwal. Welcome, Dr. Singhal, on our show.
Thank you, sir.
Dr. Singhal, you have heard what our DGP, Dr. Babu, has mentioned. He said the police people are coming in contact, but we are taking full precautions. We means the police force is taking full precautions, and they are taking care of not only the police personals, but doing the conditions like hygiene, etc., by spraying the disinfectant in the streets. And he's also said that we are encouraging our police force by keeping them in good spirit, telling them that it is not such thing which you cannot recover. And once they come back, we honor them and then again give them the kits so that they are again ready to work. Now, we would like to know from you the COVID-19 impact on police warriors' health. Dr. Singhal, please.
Thank you, sir. As mentioned by Dr. Babu, sir, I agree with him, whatever he has said, because this is a challenging situation and we are fighting an enemy which is invisible. We don't know and how we will get affected because of it. And all the warriors who are into this, they know, and over a period of time, they have learned also. Now, there are different levels which I feel we are getting affected. The most important one is the psychological level or the mental level. And second is the physical level, which also is affecting us. As in my range, there are about 21, 23 policemen who have got infected. And in Maharashtra, we had about 6,000 police personnel getting affected because of this. And we have lost about 75 police personnel, which is a big number. So in this scenario, we are doing our best, and Government of Maharashtra and Director General Police, they have issued different instructions, SOPs on different occasions. They have also given us different kind of medicine which are approved, as mentioned by sir also. And we have arsenic 300 or camphor 2 mg, or they're different. They have supplied us with the PPE kits also, whatever possible from Director General Office or by the government, they have been done. In addition to this, awareness is very important because they must know what they are touching, whom they are getting contact with, or when they are at the check nakas, when people are there, they are crossing, how they have to enter, test them, take the temperature, body temperature, etc., etc. Now, when they are on duty, one is that they don't know how much time they will be spending there once they are out of their home. Then secondly, when they go back home, they may carry this virus with them. So that's very important issue which they have to handle. And for this, awareness is very important. When I mention about the mental aspect, so there we have this anxiety which is playing a very important role, or stress, or curiosity, or fear, because this is disturbing them, because they don't know what is going to happen to them because they are exposed like doctors. So that is like one level which we are trying to enhance or encourage their motivation level. this is one. Secondly is the physical level. So during this time when they are out of home, what food, what time they will eat. So that's an issue. How to supply food to them, we are trying that also. Then with the mask, which they are not used to, so they have to put the mask every time. But during this, they are being told that if throughout you keep on putting the mask, then there's a lot of carbon dioxide which gets, away, which again affects you. So they are being taught in this aspect also what food, water, and all these things they are being taught. The kids also. Suppose they are on hospital duty, so they have to handle a corona patient when he has to be taken in the ambulance, sent to the hospital. So all these things are very, very important. As I mentioned, that they are passing through a critical phase. And overall, if you see the scenario, it is negative, so that is affecting them. So they are being taught about this. And I'm very happy that what I heard on BBC or other international news channels, in a number of countries, the police people, they absented from their duties, which is not happening in India. So this call of duty or the commitment to the duty is very important, which I'm watching in this. So that is why, as you also mentioned, the perception about the police working or the respect towards police force has enhanced to 670%, which is a big thing. Just before I was watching one of the documentaries, it mentioned that it was very low when the scenario was different few months back, but now it has tremendously increased. So this is how we are working, and the whole scenario is positive in my opinion. This is the duty which we will be doing it as it comes.
Thank you, Dr. Singhal, for giving your view. And you have mentioned very clearly that it is not only the physical, but the mental. Lots of anxiety is there with the police pupil. But the government, as well as the DGP, they are supplying the necessary medicines, the kits, etc., for the police pupil. And you have also raised one important point that once the police fellow, after completing his duty, he goes to his house, he might be carrying the infection. So you have to also create awareness among them that how to tackle the situation. And one more very important thing which people should understand, that wearing mask for a civilian is fine, but wearing mask continuously, standing in the traffic where the emission of carbon dioxide is there, it's very, very tough thing. And they have to they have to see that they have to wear the mask also, as well as they have to take precautions of the carbon dioxide level in their body. So all these points which you have raised are very, very valid, and I'm sure the public should also understand the toughness. And what he has mentioned, one thing, that Indian police service force is such a force which are always on duty, while other countries people are not attending the duties. So that type of commitment, that type of their faithfulness, their commitment to do the duty is too high. And I think we all should applaud them, and we should salute them for this type of commitment. Now I would like to go to our next guest. He is Mr. Alok Awasthi. Mr. Awasthi is the Deputy Inspector General of Police, CRPF. He has done BSc and MBA in HR. Mr. Awasthi is having vast experience in all the theaters of insurgencies. He remained posted in Northeast, J&K and LWE, infested Bastar, Chhattisgarh, and as a faculty member of Internal Security Academy and Mount Abu for 4 years. He has been awarded President's Police Medal for Meritorious Service, a Special Duty Medal for J&K and Northeast, Internal Security Medal for Left-Wing Extremist Area, Home Minister's Utkrisht Seva Medal, NDRF Medal, appreciated by Governor of Maharashtra for his commendable work post-Merlin landslide 2014, received appreciation from Indian Ambassador at Japan. He has represented India as directing staff in Assist Tax 3 on exercise on chemical emergencies organized by OPCW at Tunis, Tunisia. Also led NDRF's first overseas operation to Japan after tsunami, earthquake, and Fukushima radiological emergencies in 2011, which got widely acknowledged by His Majesty the Emperor and the Prime Minister of Japan. Welcome, Mr. Avasthi, on our show.
Thank you, sir. Good
Mr.
morning,
Avasthi-
everyone.
Yeah. Mr. Avasthi, you heard what our DGP Dr. Babu and our IG Dr. Singhal has mentioned. And they have very clearly mentioned that whatsoever is there, but the police force is always ready to work. Even if they are declared positive, they take the rest, they take the treatment, and once they come back, again they are ready to serve the people. Now that type of commitment, that type of devotion to the work is there in Indian police force. Now we would like to know from you, because you are in the CRPF, which is a paramilitary force. So we would like to know from you the COVID-19 impact on police warriors' health. Mr. Alok Avasthi, please.
Thank you, sir. Good morning, everybody.
Yeah, good morning.
Since very beginning of the pandemic, corona, we are on the ground. Initially, there was lot of mental and physical stress, but in due course, we have learned a lot how to tackle it. With the grace of God, support of the government, and the directions of the seniors, and very big love from the public, we are able to handle it very efficiently till date. What we have observed during these periods, like we are having some strength of a paramilitary force Jawan or officer, or you can say for any uniform force officer. In any case, age is with our side. None of us is more than 60 years. We are physically fit. We take balanced diet. We keep on doing regular exercises. So these things are in our favor. In addition to that, we have in paramilitary forces in battalion, we have got a proper medical setup with doctors, paramedics, ambulance, and other vehicles. So we are getting total support from the unit level also. And there was no shortage of any kind of resources in terms of masks, gloves, PPE, hand sanitizer, etc., etc., etc. So these are the things which are with us. And during these times, we have learned lot more things, like each and every Jawan has got to know the importance of the hygiene and sanitation. Standard of hygiene is improved. The standard of cleanliness has been improved a lot. And not only that, with the direction of my DG, we are running COVID care centers, the Madadgar helpline for all the retired force personnel or the family members, or anybody can approach us. Not only this, one more thing I want to share with you. We are running many civic action programs. We have distributed all kind of masks, gloves, PPE, etc. to the public, and we have run kitchens for the migrated labor also during the crisis. And one more thing, you will be happy to know that whosoever get positive after getting is declared as negative, and everybody is willing to donate plasma. And DG is encouraging everybody that if whosoever did was donate the plasma will be decorated with DG's commendation and this. So these are the things, the positive things we are doing this period. Definitely we are having some limitations also. Like sir has already mentioned, because we are living in a barracks, it is very difficult to maintain the physical distancing.
Yeah.
We are using the common toilets, common mess. These challenges are there, but in spite of all challenges, we are facing it. We have learned a lot how to face these things. I want to share one case study. One of my battalion got infected 81% in a single day. And what we did, we hired one school and we have given single room to every person. We made a WhatsApp group. In that group, myself was there, commandant was there, doctor were there, and we keep on motivating them on the regular basis. in initial phases of corona, having lot of doubts. So doctor was there for their service for 24/7, and we provided one electric kettle to each of them, good food, because that kahada and the golden milk we are giving. The diet is good, and there is definitely, I can say, the food in the CRPF is one of the best. So, because with the help of these things, WhatsApp group, good food, doctor's advice, all of 81 came out with a flying color with a negative report, and now all the 81 were ready for the plasma donation. So, in the due course, we are fighting the corona, we are helping the society, and after getting out of from this, if somebody is negative, they are ready to donate the plasma. So I can say the paramilitary forces are doing very good, and definitely in the coming days also, we'll fight it out. No doubt. Thank you.
Thank you, Mr. Awasthi, for giving the details about the paramilitary force. And you have mentioned very clearly that you were been given all the necessary things initially with PPE kits and medicines, etc. And you have also mentioned that how the paramilitary forces are supporting and doing the civil social work by providing food to the migrants and even distributing the mask, etc. And you have given a very good example of about how the 81 people from your one battalion was infected and how you have got them all cleared because of the moral boosting as well as a good medical care. And you have also mentioned one thing, that all those who have been plasma. So this type of commitment, when we have from our police force and from our paramilitary force, I am sure India can very well say that we can very well fight and we will win this coronavirus very easily. But at least the civil society should also come forward, like for donating the plasma and distributing the mask and other things. Now I would like to go to our next panelist. He is Mr. Divya Mishra, IPS. Mr. Mishra has joined in 2007. He is of Gujarat cadre, currently posted as SP Kheda. He is the district police chief with a demonstrated history of working in the government administration. He is skilled in event planning, event management, police intelligence, maintenance of law and order, prevention and detection of crime, community policing, policing during pandemic, and security. He is proficient in Hindi, English, Gujarati, along with DLF B1 level certificate in French language and A1 level certificate in German language. Welcome, Mr. Divya Mishra, to our show.
Sir, thank you, sir.
Now, Mr. Mishra, you have heard your earlier panelist, the DGP Dr. Babu, the IG Dr. Singhal, and the DIG CRPF, Mr. Awasthi. And they have mentioned very clearly that although the police people are also being infected by coronavirus, many have lost their lives also, but their morals are not down. They are doing all their things, whatsoever they can do, so that the police persons can come back again on duty to serve the nation. That is the commitment. And they have also mentioned how they are providing the facilities to their own personals whenever it's required, to giving all help, giving the proper quarantine period or the medicines, etc. Now, we would like to know from you the COVID-19 impact on police warriors' health. Mr. Divya Mishra, please.
Sir, first of all, I would like to express my thanks to Organ Donation India Foundation and to my police team at Kheda district. Because of their good work and hard work, I am here to tell you about my district story. And to my DGP sir, Shri Shivanand Jha sir, to Home Department of Gujarat and Government of Gujarat. All have been very supportive in this fight against Corona. And here all are my seniors. Shailendra Babu sir was in our training, and in Satyamangalam also he trained us long back. And thank you, sir. Pleasure to hear all of you.
Yeah, great pleasure meeting you once again after a long time.
Sir,
Yeah.
thank you.
Thank you.
I am also grateful to Ravindra sir and Avasthi sir because of their inputs regarding that plasma donation, plasma donation and giving commendation disc is a nice idea, which I will try to recommend to my DG sir. And now I'll share. The problems have been shared very beautifully by all of you. I'll share some initiatives which I took. Some of them have been taken all across the India, but some are new. So first thing first, Project Yog Prahari. This is a project which I started on a pilot basis on 11th of May 2020. In that, only officers participated initially, and they have to do 10-minute pranayam each day without fail for 21 days. And it was voluntary, but to be very frank, as SP, I exerted my authority to some extent so that a minimum participation should be there. And after 21 days, 4 officers came victorious to win this challenge. The objective is not to make sure more number of winners. That is also one of the objective, but the major objective is that maximum force and officers do it. I was not doing pranayam, but I'm very proud to say that since 11th May 2020, it's 61st day, I'm doing 10-minute pranayam each day because as the leader of the force, I have to lead by example. In phase 2, Project Yog Prahari, we have a good participation. Around 1/3 of my force, around 520 officers and men and women participated in that. 17 could complete it for 30 days and 64. This number is very important. 64 could complete it with distinction. Distinction means more than 75% time. Right now, Project Yog Prahari phase 3 is on. Participation is much higher. It's around 50% of the force. 750 odd people are there. And this time, this is 21 days. So a good participation is on. They have to do pranayam and do entry in WhatsApp group. It's a project based on mutual trust because there is a possibility someone can bluff also. But a person bluffing 21 days or 30 days continuously to SP and to senior officers in police is not possible. So that way it's working very fine. And I'll tell you the result of this effort. This was a new thing which is going on very well. Number 2, Project Sanitization Drill. This idea was suggested by our DG sir in a VC. From 4th May 2020, we started this. In all the checkposts, all the points, the men and women posted there or working there, they have to sanitize their hands each 2 hours. And they have to send me the photographs. DYSP headquarters was made nodal officer for this. So this is also working very fine. Sometimes in the night when I am checking locations through WhatsApp and all, and if they are posting pics, I just say thumbs up and clap for them. So that is quite motivating for them. And I also added to have a drill format. I make it a 1-minute drill, like Sri Vijay Kumar sir suggested us long back. And I also added one slogan. They have to shout that slogan and then they have to sanitize their hands. The slogan is, कोरोना से लड़ने के लिए है जरूरी मास्क, सैनिटाइजर और 2 गज की दूरी. This is in Hindi. I made it in Gujarati. So this also is working very fine. Each 2 hours, if you are doing it in a drill format, it makes a difference. Number 3 initiative is following Ravi Teja model. Ravi Teja is an IPS officer of 2015 batch posted as DCP Zone 5, Ahmedabad City. A very simple model, sir. And this can be emulated elsewhere also. We ask from police stations, from doctors, the health status of each constable each day. Like suppose that there are some comorbid cases, high BP and sugar. And are there any symptoms of corona? If there are emerging symptoms, immediately care is taken. So that way, nothing great, but the concept is very beautiful and very beautifully applied across Gujarat state. So Ravi Teja, my cadre mate, deserves a good credit for this. And it is working very fine because in some cases there was a normal flu or fever, but it was immediately attended. So, and number 4 is regular supply of immunity booster, as has been done everywhere, PPE kits and all, vitamin C, vitamin C, zinc, as well as we can say like Chyawanprash, GRD biscuits, so many things, multivitamins, tablets. And number fifth, regular sanitization and regular interaction. Regular sanitization of vehicles, police lines has been done everywhere, and regular interaction. This is a very beautiful point, sir, I would like to say, because sometimes I used to record audio clips and share with my constables. So in one clip at the very outset of the pandemic, because it was something very new, I thank the family members of my team members. So one sub-inspector and few constables, they gave a very good feedback. Sir, our family members also listened to this clip and they were very happy that you are thanking them, and as a leader you are concerned, and this is a nice thing because family member deserves a huge credit. Regarding stress, sir, I would only like to add one thing, especially in policing. All of you are senior police officers, sir. Whenever we are at home, we have to sanitize ourselves each time, and if some law and order issue comes up, then we have to go again. So then again you have to come back at the dead of the night, and again you have to sanitize your uniform, you have to sanitize yourself. That in itself is a big stress. So this regular sanitization and regular interaction with my team members helped a lot. In scorching heats, my DYSPs, my inspectors, including myself, we visited the checkpost, nakas, and interacted. So they felt part of the team. And now I would mention 2 points which are not directly, they did not directly reduce the stress, but indirectly that was a great initiative. One is Project Subhashish. In this project, Kheda District Police supplied medicines and groceries to lone senior citizens who are living alone, to critically ill patients who are living alone, and to single women who are living alone. There was a system created, WhatsApp, Facebook and all, and we supplied to all the senior citizens of Kheda Police. I must tell you, sir, the kind of stress buster it was for my team, and I congratulate my team. I didn't go to a single place, but my team members went, and the Subhashis, the good faith, the good Ashish, or the blessings of senior citizens of this district we got was a great stress reliever, because we were doing a tremendous job, and we have such a good 51 success stories. It continued till lockdown 4. After unlock 1, things were not required because markets were open. And last but not the least, Project Chahak. As we all know, we all believe in Vasudhaiva Kutumbakam, and flora and fauna and everything is part of our society. So in Project Chahak, at 32 locations, Kheda District Police fed the birds, the pigeons 2 times a day. And it continued for 86 days. After 30th June, this project got over, and it started on 6th of April. So these 7 initiatives, sir. And last but not the least, I must tell you, I'm not boasting, but it's God's grace and blessings of my seniors and all of you that till now in my district, maybe because of these efforts, maybe because of our humble efforts, not a single person, officer or man, is corona positive. So it's an achievement. It's a tough fight still, but I think if we continue doing these things like Project Yog Prahari, I think we will continue to win. Now I'll show you some pics, sir. I'll mute my video and I'll show you some pics. I would hardly take 1 more minute. Thank you, sir.
Now you can unmute yours. Now you can unmute Mr. Mishra.
Sir, this is yes, this is that project sanitization drill, sir. Video is a bit hazy. These 20 seconds, washing hands in all directions. Next. This is Project Subhashish, you can see. Senior citizens are being it has been done everywhere in Mumbai, in Chennai. I'm not saying that is something unique, but we started in Kheda, got a very good response. Next. This pic was very much viral in media, and we got very good media support also. Next. This is Project Heck. You can see pigeons 2 times feeding a day at 32 locations. Next. Another Project Heck. Next. This is Ravi Teja setup. It's not very much visible, but high BP patients, sugar patient, affected from sugar, any symptoms of early monitoring of early symptoms, and it works. Next. These are the medicines which are supplied by Home Department. I am very grateful to Home Department and my DG sir because we got enough funds for this. Next. This is regular sanitization of vehicles and all. Next. Thank you, sir.
Thank you, Mr. Mishra, for giving the details. That how your district or in Gujarat you have done so many, you have taken so many initiatives to see to it that not a single police officer or police jawan is been declared as a positive corona. And you have mentioned about the yoga. You have mentioned about how you are giving the hand sanitization drill, which is encouraging the police people to do it. And you have also mentioned about the senior citizens, Ashish, the blessings which you are taking from them by giving them, providing all the necessary groceries or the food. And you also mentioned how to keep the vehicles sanitized. And the last but not the least, which is very, very remarkable, was that you are also caring for the birds, which shows that the police people, although everybody feels that the police people they don't have heart, they are made of stone or iron. No, but they have a heart, a very, very soft heart, like a child, because they care for all of us. Now I would like to go to our DGP, Dr. Babu. Dr. Babu, what are some ways to protect the police personnel from the risk of infections, since they are highly exposed to the population?
Yeah. Okay, so it's very interesting to listen to the young officers, particularly to Divya Mishra's 7 very imaginative schemes. Probably we can also copy it. Many young officers here also willing to adopt any kind of innovative ideas in their own limit. We also hear some officers with their own programs. So I would like to highlight some of the hopes. So one of the greatest hope, or that we can really succeed, the police force will really succeed, is the government support. In Tamil Nadu government, I can tell you with authority that the government of Tamil Nadu has been extremely kind and generous with us, even at this point of pandemic, in point of economic crisis. All the policemen as well as the firemen are given extra allowance for their work, so that they can protect themselves. They can buy articles meant for sanitization and their own equipments. So apart from this, in the fire department, we wanted certain equipments for a small, narrow streets. We wanted motorcycles. They immediately gave 225 motorcycles. The government has given 50 4-wheelers. The government has given. So the work is being done in a nice way. It's government support. The DGP and the head of the police force has been encouraging the police. He has been in constant touch with these people. The directives, the advisories are all communicated well on time. So something which other officers also mentioned, Divya Mishra and Mr. Rajendra Singhal, that here also, very interesting. Policemen, they are already stressed. They are in the front line. They are facing a lot of problems. Confrontation with the public. We are hearing many, people immediately take a video of the confrontation to sometimes discredit the police. So still, it's a occupational hazard. So they started helping the people, homeless people. They started feeding the people, issuing them the face mask. And the women folk, the police, men's family, the women, they manufactured the face mask and they supplied to the people. The way Mishra has done for the birds, street dogs were taken care of by the policemen and by the firemen. This kind of charity activities has been going on. I only have one single point which I want to really impress upon the police officers, policemen, and the public. which I think Mr. Ravinder Kumar Singhal will agree with me. Meditation or pranayama and those kind of our own country's method of facing such difficulty. Now there are overwhelming medical evidence coming to the extent that people who are obese and people who have a comorbidity, they are more prone to coronavirus, COVID, and more particularly to the ultimate death through COVID-19. So the only scientific way to really avoid such a casualty is to keep oneself really fit. And that is possible only if you really take up real hard exercise like running. So I will strongly recommend to all police officers, policemen, public, even now you can start and try to run 1 hour a day, 1 hour. Cover minimum of 8 kilometers. It may not be possible immediately, but in a few days, because we will never know how long this COVID-19 can last. It may be more, many months, or maybe a year, or even more. So in the fight against this virus, one of the easiest way to safeguard ourselves, somebody said that 2020 is not the year for business or business development or personality development. This is a year to safeguard your life. This is a year meant for living. It's enough, it's good that if at the end of the year we are living. So 1 hour running every day, everybody in the family, everybody in the force, probably our resistance to this virus can tremendously increase, and in all theoretically, all possible ways, probably none of the member of the force will succumb to COVID-19. So with this, I really conclude. It's a great honor once again to join.
Thank you, Dr. Babu, for giving the very easy way. Although it's tough for people, but the cheapest way, because there is no
expense. Run a shoe and run on the street.
Yes, if a person will run or do a brisk walking for at least 1 hour or more, then that type of immunity will increase. And that is all the medical fraternity also says that the exercise is required. And once you will be doing this exercise, definitely your obesity will also be going in a very, very...
I ran 21 kilometers around my office and 15 kilometers in my terrace and posted these videos for the public and to the policemen. Follow.
See, now this is the commitment of a DGP rank officer. So one can understand when such a senior officers can do, why not all officers, and even the public should also follow, instead of crying and instead of just making excuses or taking excuses that government is not doing this or that, when we have a very easy method to safeguard ourselves. Now, I will like to go to you would like to add something?
I would like to add sir's issue. There are 2-3 things which other panelists have also mentioned. The animals, as D sir and Mr. also mentioned, it is in this reference, I started a group on Facebook that's called the Love Animals, which has gained quite a good importance. And then I'm in Aurangabad, so people are feeding the dogs and all. This is a very good, why the perception about police has increased, because during this time, one, they were visible on the street. Secondly, they were actually interacting, visiting, like Mr. Avasti has also mentioned, they have done a lot during this time. So that is one. Second is, as sir mentioned about the fitness. So I started another group on Facebook that's called the Ambassadors of Fitness. There are about more than 1,000 people have joined there, and they are enjoying their fitness, and that has boosted their immunity level also. In addition to this, on 14th of this last month, I myself ran 90 kilometers. That's the Comrade, which is held in Africa. So I completed in 13 hours. So that is another which sir has mentioned. So that reminded me. And 21 kilometers I was also doing in my premises. So I think myself, this is sending a very good message. I think it's being visible, they can show and they can project also. I think we should take this responsibility of spreading the message of fitness and everything. And in this meditation also and visualization, these two things I've been practicing since long, and this is helping me a lot. So all these things are very good, and I think we should carry it on, and this will help everybody.
Thank you, Mr. Dr. Singhal, for giving that how you have run for 90 kilometers as well as you are doing every day.
That is too much. 90 kilometers is ultra marathon. It's not that easy. It's something remarkable. We can really appreciate him, and it appears to be a very inspiring performance. Yeah, I'm very happy to hear that.
And now this is what we want. We want that people should understand that just to say that the police is like this or that, it is not. How much hard work they are doing to maintain themselves and to become a true leader for the entire police force. Because if they are fit, then only they can see to it that all the Jawans and all their subordinates should also be fit. So they lead how they have to be fit, and that's why our entire police force has changed. And now, as he has mentioned that how the animal love, how the people were feeding the animals, and that's why the perception has gone up to 70%. And I'm sure if it will continue, the perception will go even up to 100%, and it should go. Now, I would like to ask Dr. Singhal to you is it important for police personnel to receive extra compensation for the work conducted during pandemic?
See, this is a very subjective question, and people may discuss this for a long time. But I personally believe that during this time, our own pay was down by 50%. I'm just telling for the sake of saying and I think that was our duty, and it was asked, and we have done it. This is a response. Suppose there is a war tomorrow. If we have to indulge into it, I don't think we should go in for it. Government is doing everything for us. The medical is being taken care of, all of us. Then if there is some casualty or somebody dies, then government is paying for it. There's additional compensation being given. The medical facilities, now we have erected new medical facilities. All the districts have their own medical setup now in all the district headquarters. We have made the facilities for the staff. So wards have been made. The medical supplies are being sent to them. Everything is happening. Then why for more payment? I think we are passing through a phase in which we have to contribute by all means. And that's what we are doing. No time when a single police personnel has asked for additional pay, that we are doing additional work, we should be paid more. I think that's not even in our mind or in our thoughts. That's beyond imagination. We have to work hard. That is the only agenda we have at the moment. And I think that's the only way.
Thank you, Dr. Singhal, for giving such a inspiring thing, because I am doing lots of programs on this thing, and whosoever is coming on our program, whether it's a real estate, whether it's a businessman, whosoever is coming, or the colleges, they all want the help from the government. And you people who are working, whose salaries has been reduced, still you are working with full commitment, and you have nothing against that. This is a very, very remarkable thing, and others should follow. That when the police force, which is working day and night to safeguard us, why the other people who have the businessmen or the big real estate developers, why they want all the help from the government? They should also try to help others, as the police people are doing today. Thank you, Dr. Singhal, for giving this such a good thing. Now, I would like to ask Mr. Alok Awasthi. Mr. Awasthi, today the situation what we see on the roads, the police people are wearing masks. But the medical people have mentioned that the virus can even enter through eyes. So are we providing the complete like Googles and all other things, complete face gear, so that we can protect the police people, because they are always on the road, they are contacting the people, nobody knows that who is positive or not, but they have to handle with them. If there is some congestion, or if there's somebody is coming in the car during the lockdown, the police person is stopping them and taking care. So my question to you is, are the government is supplying, or the police force is supplying all those necessary things which are recommended by the medical fraternity? Mr. Alok Awasthi, please.
Sir, basically we can divide aspect into three parts. Like for the normal policing, one can put on simple mask. If you are going to the containment zone or to the COVID hospital, or you are going to cremate the COVID victim of unattended body, for that you put on complete PPE. So we are not having any shortage of PPE. PPE covers all the aspects. Regarding putting on the goggles, that can be given, and this is a good idea. Because on the road, whosoever is there, they can put on goggles also, safety goggles. It's a good idea that we have not yet started, but PPE covers everything. After seeing the requirement, we are providing PPE. If somebody is handling the COVID positive, he is going with the PPE. Like I mentioned about the case study, whenever we visited that school where we have put 81%, we put on PPE. So if you are in the high risk of the contact, then we put on everything. Otherwise, for the normal policing also, we can provide goggles.
Okay, thank you, Mr. Awasthi, for saying that the police, wherever they are going for the infectious area, the containment zone, they are having the PPE things. And now you have said that you will also recommend for the Google for the normal policing also. Now, my question to you, Mr. Mishra, is that because you have mentioned that nobody has become positive because of your efforts. But if we will see the larger picture all over India, many places the police people have to suffer from this. So, and the main problem is the anxiety, the depression, because they are working so much, they have to think about their family also and whatnot. So don't you think that this is the right time when every police headquarters should have the consultation clinics for the psychologist and separate medical facilities, so that they will not have to go and stand in a queue on a normal in a government hospital or wherever. They can have a priority treatment, because after all, you people are working day and night and are ready to work. Even after once you become the policeman person become negative, then again they are working. So why not? This is the opportunity to create those facilities, so that in case in future also some pandemic comes or anything, that will be ideal. What is your view, Mr. Mishra, please?
Sir, you are very right, sir. And I would like to tell you that in Gujarat, our DG office is very concerned about it. And in Ahmedabad, as we know, maximum number of cases are there. So many policemen also got infected. But I must add here that a very senior rank officer, I think ADG rank officer, in the commissionerate has been designated to take care of all such constables and police team. There is one DCP also in Surat who got infected. Some senior officers also got infected. But when senior officers take care, then even hospital guys listen to us, and the constabulary is very happy that someone is taking care. So you are right, sir, and this is already on. And but your suggestion is quite welcome. And in district level also, a DYSP rank officer at least, because in Gujarat we don't have additional SP. So DYSP headquarter or some senior officer is designated to deal with such cases. So, and regarding that psychological things, yeah, that is true. And but I must tell you that the kind of appreciation we have got, sometimes we think that police is a thankless job. No, it is not. Especially during pandemic, the kind of support we got, the health professionals got, when people clapped for us, when people gave us lot of respect, when people saluted us, when the children in the street said Jai Hind to us, it was very inspiring. It took all our pain and suffering and all the tiredness in a minute. So regarding that psychological things, I would just suggest to my police team, to everyone who is listening, that please keep talking to them. Police officers and men are part of the society, and they are not always as strong. They are also vulnerable. So they need good ear. आप उनको अगर अच्छे से सुनेंगे, so this is more than enough. Thank you, sir.
Thank you, Mr. Mishra, and you have very rightly said that one should hear, because even the psychologist says that if anybody is under tension or in depression, if he speaks out, his depression can be lessened, or he can become normal. So it's a very good thing. And you have mentioned that in Gujarat, the police force, the senior officers, like Dr. Babu has also mentioned, even all our panel guests have mentioned, that everywhere the senior officers have been assigned to take care of the constables. And that is a very good, this shows the leadership. Now, I would like to ask the last round, Dr. Babu, any suggestions to the government and advice to the public?
Advice to the public only.
Yeah.
I can ask them, I'll encourage them to cooperate with the police, particularly to cooperate with the health officials. We find some of them, if not all of them, are not really following the guidelines, wearing the mask. A few thousand cases are booked against the people who don't even wear the mask, and people are found in groups. I find early morning when I go for my walking or jogging, few people come for walking, no mask, and they club together very closely, talking them between themselves. So these basic safety protocols, they have to follow. They should not bring in a situation in which the policeman should come and tell them that they should wear the mask or they should not group together and go for a case or find them closing the shop or places in the restaurants and tea shop. This behavior should be self-regulated because we don't know how long this is going to last. So unless they themselves regulate their behavior, it will be difficult to contain the spread of the disease. So to some extent, police can enforce, but the rest must come from the public. So certainly this will be my my special request to the public, general public. Thank you very much.
Thank you, Dr. Babu, for giving the advice to the public that they should wear masks, they should keep distance, social distancing. Then only we can defeat this. And we should not wait that only police people should come and tell us that we should wear the mask. That everyone should. Now, I will ask our Dr. Singhal, please. What is your advice to the public?
As mentioned by Sir, I think it is a joint effort. If we are not together, then we will lose this fight. The challenge is still on, the virus is still around, and there is a second round also. If you see in Europe, which they have passed through first phase, now there's a second phase. Like in US, what is happening, which we are seeing now. Australia also, it has happened in the same way. So it is still on. We must help the government agencies, the district administration, and whatever guidelines are issued by government, we must adhere to them. And they should set an example. Whatever community they belong to, the community leaders or the police personnel or the people who are serving in administration, they should join hands. Even a single doubt or single difference of opinion may hurt everybody. So everybody has to work together. And I think we are together, then we will be able to handle it effectively and we will be able to overcome this.
Thank you, Dr. Singhal, for giving this very good advice that everyone has to handle collectively, whether it's a community leaders or the administration or the police personnel. And once we will fight together, then definitely we can defeat. Otherwise, because the second surge of this virus can be dangerous again. So we have to adhere to the guidelines which government of the day is issuing every day or whenever they issue. Now I would like to go to Mr. Awasthi. Any suggestions to the government and advice to the public?
Sir, government is doing very good. No suggestion for them. For public, definitely, they should obey the directions of the government. They should remain cheerful. They should eat properly. They should do exercise regularly, and they should not smoke, neither drink. At last but not least, if you are got infected also, there are very, very bright chances that you are coming out from that. So don't panic. That is my advice to public. Thank you.
Don't panic. That is the advice of Mr. Awasthi, and he says don't smoke, don't drink, as well as try to adhere what the government is saying. So follow those things. Thank you very much, Mr. Awasthi, for giving this advice. Now, Mr. Mishra, your advice to the public, please.
Sir, first, I would like to have few things for government, although government is functioning very fine.
Yeah.
First of all, that Ravi Teja model can be copied. And civil defense training of our society or people should be enhanced, should be given much more attention. And in training academies, we should have this pandemic module, and we should not forget lessons of this pandemic, because after 100 years it was repeated and we didn't have much historical records. And now technology is there, we can preserve those PDFs, those documents, those communications. So that should be a part of training. We should not forget that if something comes up, we should not be found lacking. And it's not just about pandemic, it's about anything. Anything which is not planned as a society with technology, we can definitely fight. For viewers, for general public, I would like to say, friends, we are the new India. As I know, our country has always got united in times of crisis, whether it was external aggression or internal aggression. This new India, that is you and me, must lead by example by following two things. Sir, I coined a new word for this. This is COVID cum civic sense, and it constitutes three things, and that is SMS, S for soap or sanitizer, M for mask, and S for social distancing. And out of three, if we wear mask regularly and properly, I think we can fight this challenge. Second is, for Go Corona, we should go green. Go green for Go Corona. Friends, resources are limited. Production capacity is not that much right now. So if you save a single drop of water, if you save electricity, you are building nation in times of crisis. So go green for Go Corona. And the project like Yoga Prahari has much more security forces connotation. You can change this to Yoga Mitra. You can do it in your family, in your friends group. And I would like to add that I am doing in my schoolmates. Out of 87 of us, 20 are following, and they are very happy to be a part of it. They are across the globe. Some are in US, some are in Europe, and everyone is doing. And now kids are also very eager to do that. So Project Yog Mitra you can do, and who is the winner can be rewarded by the family members when the normal times comes. And last but not the least, some of us are not that fortunate to deal with this crisis. We must support them. Finances are just one part. Compassion and care are the real game changers. So in the end, I thank again my district police team, my district administration, my DM Sir Shri A.K. Patel is an outstanding officer. His support and his team support was phenomenal in dealing with this crisis. To my DG sir, to my home department, everyone, I am really, really grateful. And in the end, I would sum up with Shri Harvinsh Rai Bachchan's lines, बिना कुछ किए यूं ही जय जयकार नहीं होती, बिना कुछ किए यूं ही जय जयकार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती. जय हिंद.
Jai Hind, Mr. Mishra. You have said कुछ ना करने वालों की कोशिश करने वालों की कभी हार नहीं होती.
बिना कुछ किए यूं ही जय जयकार नहीं होती, कोशिश करने वालों की कभी हार नहीं होती.
Now, you have summed up in such a nice way that I cannot say what you have mentioned because I was so much this thing. But I would like to tell the public, our viewers, see, today you have seen how the officers, senior officers, what they are doing for all of us. After all, this is something, a unknown enemy, everyone is fighting all around the world. But Indian police, you just see the commitment, like one of our guests has mentioned, that no one is taking leaves, no one is absentees, while in other countries, people are taking leave. This type of high moral we have in the police services. We have seen how they are feeding the animals, they are feeding the birds, they are giving the foods to the senior citizen, the lone women, and whatnot. Now, this type of heart they have, even they are also infected, they are also few of them have lost their lives also, but they have not lost their morals. Whether they are not getting their full salary, they are not cribbling for that. This shows their commitment. and across the board. And you have seen today officers from different parts, from New Delhi, from Gujarat, from Maharashtra to Chennai. It's not that every government, and they praise the government, whether it's a state government or the central government. So it means that the government is doing their work. All the officers are doing their work. The police force is doing their work. We have to follow. Like our DGP, Dr. Babu has mentioned, that why the police should come and tell you to wear the mask. We must wear the mask ourselves. We have to keep the social distancing, and we have to do the hand hygiene. If we will do all these things, I am sure we will be the victorious person, and we can show that the India can lead the world. We can become the leader as far as the corona is concerned, if we will follow what our police force is doing. Thank you very much for coming and giving so much inspiration thing. And this show has been shown live today on V4 News, News Karnataka, Malnadu TV, Global TV, as well as on Facebook and YouTube. And tomorrow again, we are coming with a very, very hot topic, and that is the COVID-19 impact on Indian industries. And we have a very, very strong panelist tomorrow. One is Mr. T.R. Keshwan. He is the chairman, FICCI National Committee on Agriculture, as well as Group President, TAFE Limited, Chennai. We have Mr. Suresh B. Chaturvedi, Group Chairman, Overseas Infrastructure Alliance Private Limited, Mumbai. We have Rotarian Pawan Agrawal, Managing Director, Nani Groups, Kashipur, and we have Mr. Devendra Chaudhary, Executive Director, Aqua Plumbing Private Limited, Mathura. So please tune in again at 11 a.m. tomorrow. And thank you very much to all of my guests, Dr. C. Shailendra Babu, IPS, Dr. Rajendra Kumar Singhal, IPS, and Mr. Alok Awasthi and Mr. Divya Mishra to attend our show and giving so much inspirational thoughts to our viewers. I am sure if our viewers will follow, we will not have COVID at all. And we salute you all. Thank you very much for coming to our show. Thank you.
Thank you.
Thank you, sir. Thank you very much.
Thank you, gentlemen. See you sometimes later.
Thank you so much. Nice interacting. Thank you.
Thank you, sir. Thank you, sir.
Absolutely.
Thank you.
We'll be in touch. Thank you very much.
Thank you.
Bye.
Thank you, sir. Thank you.